Hi, I'm Daisy, and this video is not going to be flashy or have multiple graphics or anything like that. I mean, what I want to get out for the project for Awesome is simple. I have something, and so do 5 to 10% of women all over the world, called polycystic ovarian syndrome. Now, polycystic ovarian syndrome is complicated. It's not a disease. It's a syndrome, so it has so many symptoms that they don't know what causes it specifically. They're not sure if the symptoms, such as irregular menstrual periods or no menstrual periods, acne, obesity, weight gain, inability to lose weight, breathing problems when you sleep, depression, oily skin, infertility, skin discolorations, high cholesterol levels, elevated blood pressure, excessive or abnormal hair growth and distribution in places that women don't normally get it, pain in your lower abdomen or your pelvis, multiple ovarian cysts or skin tags. They don't know where it's all coming from. They don't know if the depression is what causes it. They don't know if the acne or the weight gain or whatever causes it. It's a syndrome. They're not sure. And the one thing, being someone who's been diagnosed with PCOS since 2004, the one thing that I've found is that it's scary to have polycystic ovarian syndrome. I don't know if I'll be able to have kids. I don't feel very pretty most of the time. I don't feel very good most of the time. There's also insulin resistance, where your insulin levels can be wacky and you're more prone to diabetes and heart disease and cancers. And when I got diagnosed and I was told that it would make it so cancer was easier to get, it scared the bejesus out of me. I was so afraid. But I was so confused as to what to do and where to go and who to talk to and what doctors would help and what doctors I didn't need to see. And there's so many symptoms that, depression and stuff is more of a psychologist thing, and stuff with, and then gynecologist for the baby stuff, and it makes you feel like you're alone and there's nobody that really understands how it all works, because it's different for every woman that has it. Not every woman has the exact same symptoms. So my charity is the Polycystic Ovarian Syndrome Association. They're located at PCOSsupport.org. They have a list of symptoms, and treatments that you can do for different reasons, for fertility and getting rid of depression and hair growth and cholesterol problems, and it's just hard. And what their organization does is they get awareness out to everyone, women, men, anybody who will listen, and they take your donations and try to get more research funded to figure out where PCOS is coming from. And as a 26-year-old, the last thing I want to worry about is the fact that I may or may not be able to have kids when I haven't even dated yet. And part of me thinks, well, if they don't know what causes it, then how do they know how to treat all the symptoms I have? Because something underlying is taking away the freedoms that I have. It feels like a disease because you have to work with things in your body that you've never had to work with before. All month long, every month, I deal with cysts in my ovaries that pop and break apart, and it hurts. And I don't want people who have that or any of the other symptoms I have, who have to figure out their blood sugar on a daily basis or whatever, to have to worry that their doctors don't really know what's going on. That they're just trying to, basically you just treat the symptoms because you don't know what the underlying cause is. So even though I don't have any flashy graphics and I don't, it's confusing because it's confusing to those who have it. 5 to 10%, they think 10%, not just 5, but 10% of women in the world have it. There's books about that they're getting out called the PCOS diet and how to figure out what you need to do to have fertility when you want to have kids, and it's not enough yet because there's so many people that don't even know they have it, and they wonder what's wrong and they get depressed, and it leads to so many other problems. And I think if there were more people helping with such a foundation and such a project and this association at PCOSsupport.org, that more women wouldn't feel alone and they wouldn't feel isolated and they wouldn't feel like nobody understands what they're going through, because they'd have a support group and research to back up what they're going through and they can figure it all out. So please go to PCOSsupport.org or any of the other PCOS sites that I've seen online and just make people aware of PCOS, because it's just as important as any other syndrome or disease or whatever. It changes your life. You have to change your entire life to deal with it, when sometimes you just want to have fun and you can't. So please, as someone who has it and still has yet, after almost 7 years, still hasn't figured out how to work with it yet, please help out. It would be awesome. Thanks.